I'm Amy, I'm a PT, and we're going to talk about all things falls and how to prevent them. So first we're going to hit just the standard fall precautions quickly. The first point is communicate to the patient that they're at risk for falls. Everybody on rehab is there because they're at risk for falls the majority of the time. And a lot of times they don't realize it maybe when they first get there because maybe they were walking a little more on the hospital side, had a little more freedom there, maybe it was unsafe. So communicate that to them and their family, that's a big one. Little things like making sure that things are in their reach on their tray table, at their bedside, things that take like no time at all when you're dropping them off or picking them up, or even if you're walking by and you're seeing something kind of out of reach. Hourly rounding, this is a little bit more on the nursing side, but the more we round and address the patients taking care of their needs, the less likely they are to call and say they've waited a period of time. I think a lot of the falls happen because you hear people say, oh, I called, but I couldn't wait, I had to go to the bathroom. So the more we round and check on them, the better. Environment, decrease the clutter. I know that's hard in some of our rooms with two people in one room, it could get a little crowded, but the best we could do with that, the better. Safe patient handling. Now you guys know about the iPass that we just talked about. If you're ever unsure of how a patient moves, you can always refer to that, the therapy notes, or usually you could ask one of us in the hallways. We don't know, we'll be able to tell you how to find out. Stay with me, we'll go over that, but staying with patients when they're toileting or transferring, obviously, especially if they're a new admission and we don't know how they move yet, or they haven't had all their evaluations yet, always stay with them just in case. And going over effects of their medication, if they're on a new medication, if they should be sitting for a few minutes before they get up, anything like that. So that's standard fall. Next, we're going to do ABSCSS. So ABSCSS, for anyone who doesn't know, is a video monitoring in the rooms. They'll have that flag outside of their room, so you know before you go in that they're going to be on ABSCSS, which usually means that they have some kind of cognitive impairment. They're very impulsive. They're more unsafe. They don't remember to call, or they don't want to call. A big thing for therapists to remember about ABSCSS too is when you're picking your patient up and bringing them back when they're on an ABSCSS is calling the number and notifies who's watching these people on ABSCSS that they are leaving the room. And then when you call and that they're back, they have to watch them again. Sometimes if we forget, it happens, but then they'll look and see the patient's not in the room and they don't know where they are, maybe they missed it, so then they're calling the nurse. Sometimes they sound the alarm. So it just keeps everybody aware of where the patient is. So any questions with ABSCSS, we're good?
It'd be nice if they had like the phone number somewhere.
They do.
Yeah,
I'm sorry if I didn't say that.
Yeah, a lot of times
It's
not.
oh, it's not.
Well,
It should be
sometimes rubbed
on the
off.
actual ABSCSS.
Yeah, a lot of times it's rubbed off and you can't
Okay.
find it anywhere.
But that's it's 2917, but it's always.
We're gonna do that.
We should probably put that on board.
Yeah.
But good to know. I didn't know that. Next is stay with me. The yellow star always means they're at risk for falls, but if there's ever a black dot in the star, this exact thing will be right outside their room next to that if there's one of these two, which means if they go to the bathroom, you absolutely have to stay with the patient because they will not call, or they'll get up on their own, or they're impulsive or unsafe. So you have to stay with them while you bring them to the bathroom. That we find is actually pretty helpful with preventing falls. A lot of the falls happen in the bathroom. Next is bundling the alarms. So we can try to keep all our alarms bundled. So if you're getting a bed alarm, it'll come with a chair alarm, because if you're gonna put an alarm on someone on the bed, if they go to sit in a wheelchair for dinner, there should be an alarm on their chair while they're eating dinner. You'll see a posy a lot, hooks on their wheelchair. This hooks on to the back of them, but a lot of times they get smart and pull it off because they see you pulling it off of them. So that's when the seatbelts come in handy. Oh, also, this sounds silly, but make sure there's batteries in these. Just always check, because sometimes they're attached without a battery. So just always check if there's a battery. If not, they're always at the nurse's station. Next is the seatbelts. This people I feel like have a hard time using, so we'll go over that. So I'm the patient in a wheelchair. Posey alarm, let's say they keep pulling it off of them because they know how to take the clip off. So you want to give them a seatbelt alarm. So this is a restraint if you don't tell them how to take it off. So you have to tell them how to take it off as well. So I'll take it off first. It's easier if you strap it around the wheelchair. This will attach to something similar to the Posey, the battery, and you just hook it on their chair or like their bed rail if they're close to the bed rail. You always match the colors together. So blue goes to blue. Velcro it on, and I always think the yellow strap is what they pull to take it off. So the yellow strap always faces out, gray to gray. So it has to be two. And then when it's actually attached and on, it'll make like a beep. That's how you know that the sensors are aligned and that when they pull it off, they have to pull off twice. You know, they have to do one pull and then the alarm will start to go off. So hopefully by the time this goes, somebody's there and it has alerted you for a little bit by the time they pull this one off. So you have to show them how to take it off. Make sure you tighten it or loosen it depending on what you need. Questions about this alarm?
I think the only thing I would add is they need to be able to demonstrate they know how to take it off. Because if they don't know how to take it off, then it's a restraint.
Yeah, so always, you know. this
Should we
one's a little-
document, in our notes, the patient instructed and demonstrated,
Yeah, if you just,
Independently.
especially if you initiated
return
it.
demonstration, whatnot, yeah.
Yeah, I would, especially if you're the one that initiates it. And if any of these aren't in place and after you've treated the patient, you feel like they would benefit from this versus the Posey versus, you know, if you think they should be on Avasys and they're not, let's say they're newer and you're finding impairments where you think that, you know, they're going to get up without calling, or maybe they'll even tell you. That happens all the time where they tell you, yeah, I did this by myself in the room. And the nurse hasn't implemented it. Definitely feel free to notify them and let them know if you think they'd be a candidate for Avasys. Last is Sarah Steady. I don't know who has used this or not, but it's, I guess, kind of newer to 5 North. It's a transfer assist device, really. So you can adjust the base of support on the bottom, depending on like where you are, if you have more room or not. So let's say I'm the patient. Yeah, actually, you want to sit? So you're gonna bring it straight up. Let's say you bring them to the bathroom, you bring it all the way up. It locks just like the commodes and everything else. So you lock both wheels, make sure her feet are on here, this platform. You're gonna have her reach, she could reach for here, have her stand up, and then you pull both these back, and then she sits. So now she's good. Your hands are free. You can get her to the bathroom or where she needs to be. This is preventing her from sliding forward. She can put all her weight back and relax, and she's good. One patient population I would be wary of to put in the Sarah study is if like a dense stroke that has poor trunk control, you know, then she's gonna be falling all the way over to the side. You have to push this, hold her up. That becomes like a 2-person transfer. Maybe you're better off, you know, using a slide board or just a wheelchair or just like a bedside commode with a drop arm, something like that. Maybe this isn't the best for that clientele, but just someone who has good trunk control. This is like a great device.
It's also great for men in urinals, by the way. Those who are not so steady to stand up yet, but then they can have their hands free and they can be a little bit more secure. So this is one of my favorite tools for that.
Yeah.
And also easier.
Yeah, and then you just bring them wherever, bring it back.
What is the weight limit?
I think it says it on here somewhere. Is it 3?
300.
I think it's 300, right? 300? So you walk again before she sits. She holds on, you help her up, undo the support in the back. And then she sits, and then you could do it. What was a 2-person, hopefully a 1-person, and safer and more comfortable for them too. Any questions about this? We have this on 5 North, so if you don't see it, it's around, just, you know, ask somebody.
One of my other favorite uses is you can even park people in front of the sink because then they can brush their teeth and
Oh,
wash
yeah.
up as well. And when they stand and do peri-hygiene, you have a little bit of something where their endurance isn't so good.
And they can take breaks and sit back on it and stand and go back and forth, so. I think that's it for me, unless you guys have anything else. Any questions?
If we don't see it, go back to the alarm, sorry. but
Yeah.
That might be a dumb question, which
No,
I
it's
already know the answer, but I'm gonna say it anyway. Like if there, a couple weeks ago, I had a eval that I had to go do and 540 or 541, I don't remember, but it was just, he had a alarm on his bed, but not on the chair, but it looked like that with a clip.
This,
No, that was the one.
Oh,
that
this.
one. So I guess we don't see it on the chair, just take it off the bed and put it on the chair. That's what I was gonna do.
Correct.
So
especially if there's no strip
Obviously,
too,
right.
sometimes people stick this on them and then they
Right.
just move it from the bed to the chair.
Obviously, just bring it with you wherever you're going.
Yeah.
So it's
Yeah, if you're
safe.
taking them out, I would bring it on a wheelchair.
The newer ones are the chair ones, which are the small ones. We've always had the big bed ones, but now we have the smaller chair ones as well. Because you'd have to take the big one off and then put it
Right.
on like the Jerry chair if they were sitting there. And then put it back on the bed, and then sometimes the transition didn't happen.
Okay.
So now we have the small one for the chair, or for, if you were leaving and sitting in the wheelchair, versus the big one for the bed. Then there's the cozy, sometimes people have all the vehicles.
Yeah.
And a one-on-one.
And one and an abscess, and,
Mhm.
but, we're trying to actually bundle them up as a unit, so that way if you use one, you kind of are getting all of them. So.
Thank you.
Thank you.